What if the anxiety you experience on a daily basis is more than a passing mood? What if it's subtly influencing your attitudes and actions without your knowledge? Maybe what appears to be just cumulative stress is something more organized and more enduring. However, how can you distinguish between a genuine problem and ordinary worry? And where does one draw the boundary between what is reasonable and what is excessive? A disorder known as Generalized Anxiety Disorder, or GAD, may be the source of anxiety that lasts longer than 6 months, happens nearly daily, and has no identified explanation. The diagnosis adheres to clear rules while seeking expert assistance. To identify mental disorders, experts refer to a document known as the DSM-5-TR. An acute, protracted, and hard-to-control worry is one of the hallmarks of GAD. Along with the time, the person must exhibit at least 3 of the 6 symptoms listed: a persistent sense of tension, unidentified weariness, difficulty concentrating, irritability, disturbed sleep, and an intractable physical restlessness. A frequent sign of sleep disturbance is difficulty falling asleep, waking up several times during the night, or just not feeling refreshed when you get up. However, routine, professional performance, and interpersonal interactions are all strongly impacted by these manifestations. When interpreting the diagnosis of generalized anxiety disorder, people frequently assume that there must be both functional and clinical impairment. One of the two is actually sufficient. Many people have not been able to identify what they are going through because of this misconception. Since people are still able to work, study, and do duties, they believe that it can't be that serious. In actuality, however, a lot of people have ongoing anxiety on the inside while acting properly on the exterior. Unending anxieties, built-up stress, and trouble unwinding can all exist even when everything appears to be in order. Aches, exhaustion, and restless nights are some of the symptoms that some people only become aware of when their bodies begin to react. It's critical to realize that chronic pain, ongoing stress, sleep deprivation, or strained relationships are all indicators of serious clinical damage. For the pain to be legitimate, you don't need to collapse. Although functionality might persist, life quality will progressively decline. Other factors must also be ruled out in order to confirm the diagnosis. Medication, drugs, or illnesses shouldn't be the cause of the symptoms. Furthermore, they cannot be connected to other conditions like PTSD, social anxiety, or phobias. There is treatment, which is wonderful news, and it's effective. The primary advice for people dealing with this kind of anxiety is cognitive behavioral therapy. It aids in seeing trends, altering perspectives, and identifying workable solutions to suffering that are supported by science. For those with generalized anxiety disorder, cognitive behavioral therapy, CBT, is thought to be the main treatment strategy. In addition to clinical practice, a large body of scientific data supports this suggestion. The fact that CBT is the first-line treatment for anxiety disorders according to the World Health Organization, WHO, itself attests to its effectiveness and global reach. According to psychologist Judith S. Beck's book, CBT, Cognitive Behavioral Therapy, Theory and Practice, 2nd edition, CBT specifically addresses the cognitive processes that underlie anxiety. Finding automatic thinking, stopping unhealthy habits, and cultivating more balanced emotional reactions are the explicit goals of the plan. CTB provides useful, everyday techniques that assist patients in taking back mental control. According to the research Beck provided, cognitive behavioral therapy, CBT, not only reduces existing symptoms but also keeps them from returning. This is due to the fact that the therapy process encourages long-lasting modifications in the way the person perceives and responds to circumstances. Because of this, medical and psychiatric facilities all over the world use it as their main resource for treating anxiety. But not every case proceeds in the same way. CBT can be used in conjunction with techniques like EMDR when anxiety is closely associated with traumatic events. Additionally, medication may need to be used if, after 6 to 9 months, there is no discernible improvement. Selective serotonin. Reuptake inhibitors, or SSRIs, are the most recommended medication in these situations. They lessen mental rumination and interrupt the compulsive patterns that fuel worry. Although medicine, particularly SSRIs, may provide some people with short-term relief, it's crucial to be aware of the drawbacks of other often recommended drugs for anxiety. Despite their historical usage, benzodiazepines are not advised as a primary therapy for generalized anxiety disorder, according to the American Medical Association, AMA, and the World Health Organization, WHO. The explanation is straightforward. These drugs have little long-term efficacy and a substantial risk of dependency. The sensation of comfort is followed by a decrease in the body's natural relaxation hormones as the medication starts to exit the system. This is known as a biphasic effect. The outcome? A rise in anxiety reinforces the cycle of addiction by generating an instantaneous link between comfort and drugs. Many people who attempt to stop experience challenging negative effects. As a result, more sustainable options are suggested by the AMA and WHO, including mindfulness exercises, body grounding techniques, relaxation techniques, and stress management methods. In addition to reducing symptoms now, these methods fortify the brain to withstand relapses in the future. They provide genuine avenues for self-reliance and reestablishing a connection with one's own body. Now is the moment to take action if you think you could be suffering from generalized anxiety disorder. There are safe, proven, and efficient ways. It is possible to escape the cycle of worry and develop a more harmonious connection with one's own mind with the right support. The first stage is information. The second is deciding how to use it. I appreciate you following along thus far. Be careful, and keep in mind that you're not doing this alone. Share this discussion with someone who might be caught in the similar cycle if it was helpful to you. Additionally, you may subscribe to the channel here if you would want to keep discussing these subjects with me. Be gentle to yourself. And until we meet again.